Hey guys, I am Mary Frey. I am a cystic fibrosis patient. I'm 26 years old and I have had the privilege of spending time in 5 different CF clinics between the United States to Scotland, and it has been quite an adventure of seeing how different clinics do things, how different hospitals run, and that sort of thing. We just watched the North American Cystic Fibrosis Foundation Conference, and we watched the session on infection control and prevention, and it was really informative about what the Cystic Fibrosis Foundation recommends for infection control and prevention, as well as what certain clinics do for their guidelines. As a CF patient myself, I can say that the balance between infection control and this feeling of isolation for the patient, that is a hard balance, and it's a real challenge. I spent a month in the hospital and I was in isolation, so I was in my room the entire time with the exception of a few trips out for medical testing and that sort of thing. And when I am taken out of the room, it's with precautions in place. So spending a month in that hospital room, and that's not the longest that a CF patient has spent in the hospital. Other people have spent longer. So I'm just saying from my experience, it was a challenge to know that I'm in that room for my own safety and for other people's safety, so that the bacteria that I grow won't be spread to other CF patients, and that I won't pick up bacteria around the hospital as well. I appreciate the infection control policies that are in place at the hospital that I spend time at. It makes me feel safe, and even though being in the hospital is, you're already not feeling well, and you're there for a reason, for treatment, and you need help. So you've got a lot going on mentally and emotionally. So then being stuck in a room, so it feels, for an extended period of time, it can be emotional for sure.
Yeah. One of the things they've been talking about at the CF conference, and I think there's a few sessions on it, is mental health of cystic fibrosis patients is a big issue because you are isolated.
Yeah.
You deal with anxiety and just the weightiness of having a chronic illness.
Yeah.
And I think for Mary, one of the things that when she was for that extended stay in the hospital in isolation, she had the privilege of being in a children's hospital where she had a child life specialist. And I think it would be worth thinking about what an adult life specialist would look like for CF patients.
So if you're new to the hospital world, a child life specialist is a person who has gone to school for, I would describe it as mental health / playing therapy.
Yeah.
It's somebody who comes into the room and says, "How are you doing?" Just hang out and take your mind off of the medical aspect and just be a child or be an adult, wherever you find yourself. So as an adult, the child life specialist would come into my room in full infection control policy garb.
Which would be full gown that goes down to the wrist,
sleeves,
gloves,
and would have washed their hands and done all of the protocols for infection control. The person would come into my room and say, "Do you want to watch a movie? Do you need any art supplies?" Which would not be used by any other patient. They would be brought into my room and they wouldn't leave my room. There are just so many things that these individuals are trained to think about. Like when you bring a DVD in, before it goes out or before it goes into another person's room, it has to be cleaned properly. So these people are trained well for their job, and their job is to make the hospital as fun as possible. And I can attest to the fact that even as a 26-year-old patient, when the child life specialist comes to my room, I get excited because I'm like, okay, yay. They are not here to draw my blood, to take me to some torturous test chamber. They are here for my mental health, to take my mind off of whatever's happening, or to give me like a coloring sheet or whatever you find fun. While I was in the hospital, they brought me watercolor paint palette, and I discovered the fact that I love to paint watercolors. I haven't done it since I was a child, and if you are a part of the Frey life, you guys were so encouraging to me, and I have continued to paint. So thank you to that child life specialist who was so kind to bring those paints in.
Yeah, and as you think about adults, I think often the mental health aspect is taken on by social workers,
right,
who might come in and ask how mental health is going and that sort of thing. But I feel like there isn't really that person who comes in to take your mind off of that.
Right.
And
yeah, you're right.
Just to engage in something outside of what you're currently isolated to.
Yeah. We thoroughly enjoyed the
workshop on infection control.
Yeah.
And one of the things that came up was, clinics and clinicians can do all they can to make clinic and the hospital a safe place, but the responsibility really lies on CF patients outside of clinic, at your school or at college,
yeah.
At CF events, at your workplace. And we really think it's important to take on that responsibility as a CF patient.
And for me, growing up, as these infection control policies have changed and evolved throughout my lifetime, I have come to understand why the policies are what they are. I remember being told, you need to wear a mask in the waiting room, and I was so offended by that. That was many, many years ago. Now I understand why that is. And so it's just a reminder that continual education for patients as well as healthcare workers is important. And if you are a patient and you don't understand or you feel offended by those policies, it's a great conversation to have with your nurse or your doctor or somebody at your clinic. Just say, I'm feeling frustrated by, being isolated in my room. Is there anything we can do to help me understand this better or to get me through this? Because really it's a matter of these are in place for your safety or for other patients' safety. So how do we just get through this? I have come to appreciate it, and I am thankful for them now. I feel safe when I'm in the hospital. And even though you are in a giant building with many, many sick people, there are ways that you can feel safe, and as safe as possible. And there is a matter of human error with these policies. We're all human. We're going to forget to put our mask on once in a while, and that's okay. We just need to, as they said in the conference, when you realize you've forgotten something, step back, step out of the room, fix what you've forgotten, and continue. That's all we can do, is do our best.
Yeah, and like Mary said, it's a matter of feeling safe. And I think for patients and families, it sometimes requires shifting your perspective from what are they limiting me from to how are they keeping me safe.
Yeah, that's a good way of thinking of it. So if you guys are CF patients and you have thoughts on this topic, we would love to hear from you down in the comments. I know that some patients and some CF centers do infection control policies differently. We've seen that in the different clinics and hospitals that we've spent time in. So I think it's a discussion to have. And if you are interested in the evidence-based, the policies and the evidence behind those policies, it's all listed on the CF Foundation website, and we will have
it linked down in the description.
So if you're interested in reading more about why the policies are what they are, you can read that there.
And if you're interested in looking at kind of just like a patient and friend perspective on this, Mary and her roommate did a question and answer about what it was like to be in college and be roommates with CF and to do infection control and manage sickness.
We weren't both CF patients, just me.
Yeah, that would be
tricky.
Tricky.
So thank you guys so much for tuning in for this patient and spouse review.
Yeah, we just wanted to just kind of give our feedback and review as we watch the CF conference. So thanks to the CF Foundation for putting on the conference, and thank you guys for watching.